What if I told you that something sitting in most people's kitchen right now, something that costs almost nothing, has been studied in peer-reviewed research for its effects on blood sugar, blood pressure, cholesterol, and chronic inflammation, and that the reason most people who try it see no benefit is not because it doesn't work, but because they're using it completely wrong? I've been working with patients over 60 for years, and in that time I've watched the same pattern repeat itself dozens of times. Someone hears about apple cider vinegar, they buy a bottle, they take a sip straight from it, grimace at the taste, feel a burning sensation in their throat, and decide it's not for them. Or they dilute it, take it inconsistently, and when nothing dramatic happens in a week, they put the bottle at the back of the cabinet and forget about it. What they never got was the information that would have made it actually work. The right type of vinegar, the right dose, the right timing, and an honest, grounded understanding of what apple cider vinegar can and cannot do for a body over 60. I'm Dr. Jake Taylor, and today I want to give you that information clearly and completely, not promises of miracle cures, not exaggerated claims that no responsible physician would make, but an honest explanation of what the research shows, what apple cider vinegar actually does inside your body, how to use it in a way that is safe and effective, and who should be cautious before starting. If you're over 60 and managing blood sugar, blood pressure, digestion, or weight, this video is worth your full attention. Write your country in the comments, and if you're new here, subscribe and turn on notifications. I make these videos every week for people who want evidence-based health information without the exaggeration. Let me tell you about Frank. He was 71 when he came to see me, and he was frustrated in the particular way that only comes from trying hard and not getting results. He was managing type 2 diabetes with medication, watching his diet carefully, and still seeing blood sugar readings that were higher than he and his doctor wanted. His A1C had been stuck at 7.9 for over a year. He'd heard about apple cider vinegar from a neighbor and tried it for 2 weeks. Nothing happened. I figured it was just another health trend, he told me. When I asked how he'd been taking it, the picture became clear immediately. He'd been taking it straight from the bottle, a small sip after dinner, flinching at the taste, and washing it down with a glass of water afterward. 3 problems right there. The concentration was wrong, the timing was wrong, and taking it after eating meant his body had already processed the meal before the vinegar entered the picture. We changed his approach entirely, properly diluted in a full glass of water, before his 2 main meals of the day, and the right type of vinegar, which his original bottle was not. 6 weeks later, his post-meal blood sugar readings had dropped noticeably. At his 3-month follow-up, his A1C had moved to 7.4. His doctor was pleased. Frank was more than pleased. "I wrote it off," he said. "I wish I hadn't written it off. Today, I'm going to make sure you don't make the same mistake he did. What apple cider vinegar actually is and why it matters. Before we talk about what apple cider vinegar does in your body, you need to understand what you're actually dealing with, because not all apple cider vinegar is the same, and the difference between what works and what doesn't comes down to how the vinegar was made and what it still contains. Apple cider vinegar begins as apple juice. Through a 2-stage fermentation process, the sugars in that juice are converted first into alcohol, then into acetic acid. Acetic acid is the compound responsible for the sharp, sour taste and smell. It is also the primary active compound behind most of the health benefits that research has documented. But here's what most people miss. The fermentation process also produces something called the mother. The mother is a colony of beneficial bacteria, enzymes, and proteins that form naturally during fermentation. It appears as a cloudy, web-like substance floating in the vinegar or settling at the bottom of the bottle. To most people, it looks like sediment or impurity. Many manufacturers filter it out during processing to produce a clear, visually appealing product. That clear filtered vinegar has lost most of what makes apple cider vinegar medicinally valuable. The bacteria are gone, the enzymes are gone, the probiotic value is essentially 0. What remains is primarily acetic acid in water, which has some benefit, but a fraction of what unfiltered vinegar with the mother provides. When you're selecting apple cider vinegar, look specifically for raw, unfiltered, organic apple cider vinegar with the mother. The label should say it. The bottle should look cloudy. If the vinegar is perfectly clear and transparent, leave it on the shelf. The mother provides beneficial bacteria that support gut microbiome health. It contains enzymes that support digestion and nutrient absorption, and it contains proteins and antioxidants that contribute to the anti-inflammatory properties that make this vinegar worth discussing in a medical context. This is not folk wisdom. The acetic acid content and its metabolic effects have been studied in controlled trials published in peer-reviewed journals. The probiotic value of the mother aligns with what we know about the gut microbiome's role in immune function, mood, metabolic health, and inflammation. The science is real. The mechanism is understood. What is lacking in most people's approach is simply the knowledge of how to apply it correctly. The 7 things apple cider vinegar does for your body after 60. For adults over 60, the benefits of apple cider vinegar map closely onto the health challenges that become most prevalent and most consequential in this stage of life. Let me go through each one specifically. The first and most extensively researched benefit is blood sugar management. Multiple controlled studies have demonstrated that consuming apple cider vinegar before a carbohydrate-containing meal reduces the post-meal blood sugar spike by a meaningful amount. In some studies, the reduction has been as high as 20 to 30%. The mechanism is well understood. Acetic acid slows gastric emptying, meaning food leaves the stomach and enters the small intestine more slowly. This moderates the rate at which glucose enters the bloodstream. Instead of a sharp spike that demands a large insulin response, glucose rises more gradually and the body manages it more efficiently. For people over 60 who are managing prediabetes or type 2 diabetes, this effect is genuinely significant. It does not replace medication, but it can work alongside medication to improve control in a way that is safe, inexpensive, and requires 2 minutes of daily effort. Research has also shown improvements in insulin sensitivity with regular apple cider vinegar consumption, meaning the body's cells respond better to insulin over time. The second benefit is cardiovascular protection. Apple cider vinegar has been associated in research with reductions in LDL cholesterol, the type that contributes to arterial plaque buildup, and with reductions in triglycerides, the blood fats that elevate heart disease risk when elevated. It has also shown modest but consistent effects on blood pressure in multiple studies. The mechanism for blood pressure effects involves the acetic acid's influence on a specific enzyme that regulates blood vessel constriction. By inhibiting this enzyme, apple cider vinegar allows blood vessels to relax slightly, which reduces the pressure against which the heart must pump. For someone managing borderline high blood pressure, this is a meaningful additional tool. The third benefit is digestive support. After 60, the stomach naturally produces less hydrochloric acid. This creates a paradox that many people don't realize. The digestive symptoms that feel like too much acid, the bloating, the gas, the heavy, uncomfortable feeling after meals, are often caused by too little acid, not too much. Insufficient stomach acid means food is not properly broken down in the stomach before moving into the small intestine, where it ferments and produces gas. Apple cider vinegar, taken before meals, stimulates the production of digestive enzymes and supports stomach acid levels. The result for many patients is a meaningful improvement in digestive comfort. Less bloating, more predictable digestion, better nutrient absorption from the food they're eating, and the probiotic bacteria in the mother support the gut microbiome, which plays a role in everything from immune function to mood to the efficiency of nutrient absorption. The fourth benefit is inflammation reduction. Chronic low-grade inflammation is now understood to be the underlying driver of most of the conditions that become more common after 60. Heart disease, type 2 diabetes, joint pain, cognitive decline, and even some cancers are all linked to sustained inflammatory activity at the cellular level. Apple cider vinegar contains polyphenols and antioxidants that reduce oxidative stress, one of the primary drivers of chronic inflammation. Several of my patients who began using apple cider vinegar primarily for blood sugar management have mentioned unprompted that joint discomfort decreased over the following months. The research on this specific effect is less robust than the blood sugar data, but the anti-inflammatory mechanisms are well established, and the clinical observations are consistent enough to be worth noting. The fifth benefit is weight and abdominal fat management. For adults over 60, carrying excess abdominal fat is particularly consequential because visceral fat, the fat stored around internal organs, is metabolically active and contributes directly to inflammation, insulin resistance, and cardiovascular risk. Apple cider vinegar has been shown in research to increase satiety, the feeling of fullness after eating, which naturally reduces overall caloric intake without requiring willpower or active restriction. Studies have also shown modest reductions in visceral fat, specifically with regular consumption over several months. The sixth benefit is mineral absorption. Calcium, magnesium, and other minerals require an adequate acid environment in the stomach to be properly absorbed. The same reduction in stomach acid that impairs digestion in older adults also impairs mineral absorption. Apple cider vinegar improves the acid environment in which minerals dissolve and become bioavailable. For someone over 60 who is concerned about bone density and taking calcium supplements, this is a meaningful consideration. The supplements are only useful if they're actually being absorbed. The seventh benefit is liver support. The liver performs over 500 functions in the body and accumulates the effects of decades of medication, environmental exposure, and metabolic demand. Research has shown that acetic acid supports healthy liver function and may help reduce the accumulation of fat in liver tissue, a condition called non-alcoholic fatty liver disease that is increasingly common in people over 60 and that raises cardiovascular and metabolic risk significantly. Dorothy was 68 and had come to me after a routine blood panel showed elevated liver enzymes and borderline triglycerides. She wasn't a drinker. She ate reasonably well, but she'd been on multiple medications for years and her liver was showing the strain. We incorporated apple cider vinegar alongside dietary adjustments as part of a broader approach. 4 months later, both her liver enzymes and her triglycerides had normalized. Her doctor was satisfied with the progress. "I didn't expect vinegar to be part of the answer," she said, but it was. How to take it so it actually works. This is the section that determines whether you get results or waste your time. The what matters, the how matters just as much. The dose is 1 to 2 tablespoons of raw, unfiltered apple cider vinegar with the mother. That is 15 to 30 milliliters. Start with 1 tablespoon for the first week and move to 2 if your stomach tolerates it well. More is not better. Exceeding 2 tablespoons per day provides no additional benefit and increases the risk of digestive irritation. Dilution is absolutely non-negotiable. Never consume apple cider vinegar undiluted. The acidity is sufficient to damage tooth enamel, irritate or injure the esophagus, and cause significant stomach discomfort when taken straight. Dilute your tablespoon or 2 in a full glass of water at minimum 250 milliliters. Warm water is preferable to cold because warm water preserves the live bacteria in the mother, which cold water can partially inactivate. If the taste is difficult, a small amount of fresh lemon juice or a teaspoon of raw honey can be added. Both complement the health profile of the drink and make it more palatable without diminishing the benefits. Timing is where most people fail completely. The therapeutic benefit of apple cider vinegar for blood sugar management comes specifically from consuming it before a carbohydrate-containing meal, not after. Taking it after eating means the meal has already begun processing and the window of metabolic advantage has closed. Take it 15 to 20 minutes before your 2 largest meals of the day, typically breakfast and dinner. This is when the glucose moderating effects are active and when digestive enzyme stimulation is most beneficial. There is one practical detail worth adding about the water temperature. Some people find warm water uncomfortable in the morning, particularly in warmer months, and prefer to use room temperature water instead. Room temperature is acceptable. The key distinction is avoiding cold water specifically, because cold temperatures reduce the activity of the live cultures in the mother. If you genuinely cannot tolerate anything other than cold water, use it, but understand that you may be getting slightly less probiotic benefit from each serving. The acetic acid benefits remain intact regardless of water temperature. After consuming the drink, rinse your mouth with plain water. Do not brush your teeth for at least 30 minutes afterward. The acid temporarily softens tooth enamel, and brushing during this window causes microscopic abrasion. Rinsing with water is sufficient to protect your teeth in the short term. Drinking through a straw is an additional precaution that some of my patients find helpful, as it minimizes contact between the acidic liquid and tooth surfaces. Margaret was 72 and had been managing blood pressure with medication for 6 years. Her readings were controlled but consistently at the upper edge of her target range. We added apple cider vinegar to her morning routine, 1 tablespoon diluted in warm water with lemon, 20 minutes before breakfast. Over 3 months, her morning blood pressure readings moved consistently lower. At her 6-month medication review, her doctor reduced her dose slightly for the first time in years. Something is working differently, her doctor told her. Margaret knew what it was. Start slowly if you have a sensitive stomach. Begin with half a tablespoon in a full glass of water for the first week. Your digestive system needs time to adjust to the increased acidity. Most people who experience initial discomfort find that it resolves completely within 1 to 2 weeks as the body adapts. If discomfort persists beyond 2 weeks, reduce the dose further and give it more time before attempting to increase. Consistency matters more than any single aspect of the protocol. 1 tablespoon every day for 3 months will produce measurably different results than 2 tablespoons occasionally. The metabolic and microbiome effects of apple cider vinegar build over time. This is not a supplement that works dramatically in the first week. It is one that works reliably over months, which is a different thing and a more valuable thing. When apple cider vinegar can be dangerous. Apple cider vinegar is safe for most adults over 60 when used as I've described, but there are specific situations where caution is warranted, and I want to be direct about them. If you take medication for diabetes, blood sugar monitoring becomes more important when you add apple cider vinegar to your routine. The glucose-lowering effect of the vinegar combines with the glucose-lowering effect of your medication, which is generally beneficial, but means readings may shift downward more than your medication was calibrated for. Monitor your readings more closely in the first month and report any unexpected lows to your doctor. In some cases, medication doses can be adjusted downward over time as vinegar and dietary changes improve overall control, but that adjustment must be made by your physician, not independently. Your 30-day commitment. I want to leave you with something concrete. For the next 30 days, commit to the following. Purchase raw, unfiltered, organic apple cider vinegar with the mother. The bottle should be cloudy. The label should specify that it contains the mother. 1 tablespoon diluted in a full glass of warm water, 15 to 20 minutes before your 2 main meals each day. Rinse your mouth with plain water afterward. Keep everything else in your routine the same so that you can clearly observe what changes. One thing I tell every patient who starts this protocol is to keep a simple log. Not an elaborate journal, just a note on their phone each morning with 2 or 3 numbers. Blood sugar reading if they monitor it, blood pressure if they monitor it, and a 1-word description of how they felt after dinner the night before. Comfortable, bloated, heavy, fine. It takes 30 seconds, and over 30 days it builds a picture that is far more informative than memory alone. At the end of the month, patterns emerge that you would never notice day to day. The log is what turns an experiment into evidence that you own personally, about your own body, not someone else's research trial. Track 3 things during those 30 days. If you monitor blood sugar, record your post-meal readings. If you monitor blood pressure, record your morning readings, and pay attention to your digestion, specifically how you feel in the 2 to 3 hours after eating. Less bloating, less heaviness, more comfortable digestion are often the first changes people notice, typically within the first 2 weeks. At 30 days, assess honestly. If your post-meal readings have improved, if your blood pressure has shifted, if your digestion is better, you have your answer. continue for another 60 days, and then get blood work done if you're due for it. Cholesterol, triglycerides, fasting glucose, A1C if applicable. Let the numbers tell you what has been happening over 3 months of consistent use. If 30 days produces no noticeable change, there are 2 possibilities. Either the timing or dosing wasn't consistent enough, or apple cider vinegar is simply not producing a response for your particular physiology. Both are useful things to know, and neither costs you anything but a bottle of vinegar and a month of 2-minute morning rituals. James was 69 and came to me with the particular skepticism of someone who has tried many things and been disappointed by most of them. He agreed to the 30-day commitment more out of respect for my recommendation than genuine belief. At his 30-day check-in, his morning blood pressure readings had dropped by an average of 8 points, and he had lost 2.5 kilograms without changing anything else. "You should lead with those numbers," he told me. "That's what would have convinced me immediately." I'm telling you those numbers now. Leave a comment telling me what you're hoping to address with apple cider vinegar: blood sugar, blood pressure, digestion, energy. Or tell me whether you've tried it before and what happened. Your experience helps other people in these comments make more informed decisions. If this video gave you something useful, share it with someone over 60 who is managing any of the conditions we discussed today. The protocol is simple, the cost is minimal, and for many people, the results are anything but minimal. Subscribe if you haven't already. I'm Dr. Jake Taylor. Take care of yourself, and I'll see you in the next video.